today, October 10th, it is World Mental Health Day. And according to the Centers for Disease Control, the CDC, 1 in 5 American adults will experience a mental illness this year. Now, of course, there are treatment options, and that includes transcranial magnetic stimulation, which is a non-invasive option. Joining us more this morning to talk about it, Dr. João de Quevedo, a psychiatrist and the director of treatment-resistant depression clinic with the McGovern Medical School at UT Health Houston. Doctor, good morning. Thanks for being with us. Really appreciate it.
Good morning. It's a pleasure to be here.
So, doctor, let's start with the mental health of this country. We've repeated this statistic before. 1 in 5 adults will experience a mental health issue. What is going on?
What happens is that the mental health issues, they have been increasing across the years, and especially the suicide rate has been increasing sustainable across the past 2 or 3 decades. So it's definitely a mental health emergency.
Do we know a lot about the cause and why these numbers have continued to rise?
We do believe that environmental factors could play a role on that. Childhood trauma, stress, use and abuse of drugs and alcohol, all these things could be leading to these high numbers.
Doctor, let's talk about the treatment options for depression specifically, and this idea of transcranial magnetic stimulation. I don't even know what I just said. Can you tell us a little bit more about what it is and how it works?
So, of course. So people living with depression, around 1/3 of the patients do not improve with the traditional medication and or psychotherapy treatments. For these patients, we need alternatives. And one alternative is this transcranial magnetic stimulation. So as the name say, we apply a magnetic field to the patient's brain to activate areas that are not working properly and are causing the depression.
And why the magnets? Why does that work?
The magnetic field leads the neurons to be activated. So, and therefore being activated, they start doing what they were supposed to be doing before. That is regulate the mood and make the patient no longer depressed.
Okay. How does someone know if they're a candidate for this particular treatment? In other words, maybe the other question is, how do we know when traditional treatment is not working?
If you are experiencing depression and you are taking the medications and or doing psychotherapy, if you are not improving, or if you improve it but you are not fully recovered, definitely you are a candidate to be on TMS, transcranial magnetic stimulation.
Okay. And can you tell us about any side effects potentially, or what some of these outcomes have yielded with the transcranial magnetic stimulation?
So the TMS is a quite benign treatment, does not need anesthesia, does not preclude the patient to do anything after the session. The most common side effect is headache that we can manage adjusting the intensity of the magnetic field.
Interesting.
For the patients that undergo the treatment, between 50 and 60% improve, and from those that improve, 1/3 become fully recovered from the depression.
Wow. And is this an ongoing treatment, or is this a one-time and it works for good? What?
The way that the treatment is administered is across 30 sessions. So it's done Monday to Friday for 6 weeks.
Interesting. Okay. And what about price? Is it cost? Is this something insurance will be involved in?
It's fully covered by private insurances, and also is covered by Medicare.
Interesting. Okay. Anything I missed, doctor, about this treatment that you wanted to add?
I would like to add that patients should get the full recovery from depression. If patients with depression are not fully recovered, it means that the treatment has been not good enough, and therefore they need to look for options, and TMS is definitely a very good option.
All right, so for people trying and still suffering, your message not to give up. This other treatment is available. It's very interesting. I hadn't heard much about it until today. Doctor, thanks so much for your time. I really appreciate it.
It's a pleasure to be here, and if you need anything, I will be here at UT Health Houston.
Beautiful. Dr. João de Quevedo, psychiatrist and director of the Treatment-Resistant Depression Clinic with McGovern Medical School at UT Health Houston. And don't forget, as always, if you're experiencing a mental health crisis, you can call the National Suicide Prevention Hotline at 800-273-8255. You can also text the word HOME to 741-741. But the easiest of all, which was just changed this summer, is 3 digits. You can dial 988 from any smartphone to get help.